I'm Andrew Hershey, Professor of Pediatrics and Neurology and Endowed Chair of Neurology at Cincinnati Children's Hospital. The CHAMP trial was designed as a multi-site trial sponsored by the NIH through the NINDS and NICHD, so both the Neurological and Child Institute. The original intent of the study was to try to use a real-world approach to understand which would be the best preventative medications for childhood and adolescent migraines. The study was a multi-site study. We had 31 sites actually participate in terms of enrolling subjects into the study for children ages 8 to 17 that had at least one headache or migraine per week, all the way up to nearly a daily headache. We compared the two most commonly used preventative medications, amitriptyline and topiramate, versus placebo. We were looking at whether amitriptyline was superior to placebo, whether topiramate was superior to placebo, and which of the two medications, amitriptyline or topiramate, was the most effective. We also did a safety and tolerability assessment. The study was performed over a 24-week period for each subject that participated. It took us about 3 years for the study to reach the point when the interim analysis of about half the subjects was performed. We realized that we had a definitive answer. The answer did surprise us just a little bit and opens the door to many other questions, but what we found is that the amitriptyline was effective, the topiramate was effective, but the placebo was equally effective. So it's not that the medicines didn't work necessarily, it was that we could enhance things to make placebo work also. So we were effectively able to treat 50 to 70% of the kids in terms of getting their headaches reduced by more than 50% from the frequency before the medication was started or the placebo was started. And the mean frequency they were able to reduce it to was really a goal of about 1 a week, which is ultimately many of the times the goal we get to. So the study did show that we're able to effectively, using a multi-tiered, multidisciplinary approach, treat childhood headaches, but the question that brought up is it's not the chemical properties in the medication that's doing it, that it really broadens the response of what does pain treatment mean in terms of expectation of response. How do we enhance that sort of expectation? And instead of doing what we intended to do, which was make it simple for providers to just write a prescription and be done with a patient, that we really said that the involvement, the discussion process, that integration of the patient's expectations and additional components like cognitive behavioral therapy